To screen for cervical cancer, it involves doing a Pap test, and that's conducted by your family physician, your naturopathic doctor, or your medical doctor. And this involves a speculum examination where some of the cells from the cervix are going to be removed and sent to the lab for analysis. And if it's identified that there are some abnormal cells, then further testing is going to be done. If it's in a woman who previously didn't have an abnormal Pap exam or Pap test, then there may not be any further testing. It may just, meaning there might not be any further invasive investigations, but rather the doctor may suggest that you come back in another 3 months, and every 3 months for a little while until your cervical screen is negative. It's important to obtain an HPV test when you're doing screens for cervical cancer if you're over the age of 30, because the HPV, or human papillomavirus, has been associated with up to 70% of cervical cancers. So there are actually 150 different types of HPV strains, viral strains, and about 40 of those we know can be transferred from skin to skin contact and infect genital cells. So skin to skin contact meaning through anal sex or oral sex, or standard vaginal intercourse. And so if you're having HPV tests, then you are more likely to identify if there's a high risk HPV infection. So that's about 18 different strains of HPV that we know have been associated with precancerous cervical changes or cervical cancer. And there are a few in particular that we know are sort of the high-risk HPV viral types, and then we know that there are some that are slightly lower risk. And if we do the HPV testing, then we have a better idea of whether or not this person needs to be screened a little more often, or if they can be screened less often. 70% of cervical cancers are known to be HPV-driven. However, there's still the 30% that we know are not driven by HPV, and so we still have to do that Pap test, because that Pap test can help us capture the other individuals that actually aren't necessarily HPV positive but have cervical cancer.